Prenatal diagnostic techniques. They are used to assess the fetal well-being and the risk of chromosomal abnormalities in the first and second trimesters. Unlike the third trimester assessment of fetal well-being, it has its own lecture. These tests or diagnostic methods are different from the third trimester methods. أول إشي عنا ال combined test أو ال first trimester test. It is done between 11 and 14 weeks when the crown rump length is 45 to 84. ال crown rump length لما يصير more than 84 احنا بنطلع من ال first trimester وبندخل على ال second trimester. فبالتالي حتى ال determination of the gestational age by ultrasound is not done by the crown rump length when it is more than 84%. طبعا ال first trimester combined test بتكون من maternal age, knuckle translucency and some biochemical markers اللي هم ال HCG وال PAP-A. Of course, we have some other soft markers for the chromosomal abnormalities other than these tests, but it's beyond the scope of 5th and 6th year medical students. أول factor فيهم هو maternal age. طبعا كل trisomies 13, 18 and 21 increases with maternal age. If we combine the maternal age with knuckle translucency measurements, the detection rate for the first trimester scan is about 75 to 80%. Knuckle translucency هي the maximum thickness of the subcutaneous translucent area between skin and soft tissue overlying fetal spine at the back of the neck. This is the view of the knuckle translucency. ما بدنا details بس عشان تاخدوا الفكرة كيف بيكون الشكل على الالتراساوند. The other aspect of the first trimester screening test أو ال combined test is the biochemical markers. أول إشي كانوا ال ultrasonographic markers اللي هي ال knuckle translucency وهلا عنا second component اللي هم ال biochemical. ال biochemical markers هم ال HCG وال PAP-A. ال HCG increases in trisomy 21 and decreases in other trisomies 13 and 18, while the PAP-A is always decreased in the 3 trisomies. So down بفرق عن الترايسومي 13 و 18 إنه ال HCG بيكون فيه increased while بالother trisomies بيكون decreased. الكومباين تيست كله مع بعضه لما بدنا نيجي نمسك الالتراسونوجرافيك مع البايوكيميكال ديتكشن ريت بيزيد شوية عن النكال ترانسلوسنسي with maternal age alone هو 79 ل 87%. Maternal age affects the detection rate itself. If the age is less than 35%, the detection rate is between 65 and 75, while if the age is more than 35, the detection rate increases to about 90 to 95%. Second trimester screening is done after 15 weeks. It is بتكون من 4 biochemical markers. Same as the first trimester scan, the beta HCG, normally it peaks at around 14 weeks or a bit earlier and gradually falls starting from 17 to 28 weeks. Trisomy 21 طبعا beta HCG زي the first trimester increases. Alpha fetoprotein is protein that is produced by the liver and gastrointestinal tract of the fetus. It is a marker of open neural tube defects. It also increases in trisomy 21, while it is increased in the open neural tube defects. Free estriol is decreased also in trisomy 21, while the inhibin A is increased in trisomy 21. طبعا now we don't use the alpha fetoprotein as a marker of the open neural tube defects because the detection rate of the ultrasonic findings is الديتكشن ريت فيهم أعلى. يعني احنا لما نستعمل ال signs of open neural tube defects on ultrasound, the detection rate will be higher than using the alpha fetoprotein as a marker. So the alpha fetoprotein role تاعه هو just be second trimester screening for the risk of Down syndrome اللي بيكون فيها مع ال decreased مع ال other biochemical markers الموجودة قدامنا بالسلايد. So yes, it is increased in the spina bifida and the open neural tube defects, but we don't rely on it to diagnose them because, as we said, the detection rate through ultrasound findings is better. The humble lemon sign and banana sign. You can read about them. It is, I think, again beyond the scope, but you can, if you want to increase your knowledge, you can read about the soft markers of the open neural tube defects. Integrated test أو integrated screening test هو لما نجمع ال detection rate بالcombined test وال detection rate بالsecond trimester test. It has the highest طبعا لأنه احنا بنعمل two tests مع بعض أو بنعمل interpretation ل two results. It has the highest detection rate around 95%. Cell-free fetal DNA is a somehow new technology. It is non-invasive prenatal screening. We try to collect some fetal cells from the maternal circulation. يعني هي بس بناخد عينة من maternal circulation، عينة دم عادية. We try to in a specific way we try to detect these cells. It is not recommended for multiple gestation. It has a high specificity and sensitivity for trisomy 18 and 21. We don't use it to assess the fetal anomalies such as neural tube defects and ventral wall defects. Again, because these anomalies has a better detection rate by the ultrasound findings. It's recommended for a woman after 35 years if we have ultrasound findings suggestive of aneuploidy, if we have a history of trisomy, if we have a positive first or second trimester screening result, and it is used for the parents with balanced chromosomal translocations, Robertsonian translocations. Genetic counseling about the risk of congenital anomalies worldwide is about 3%. 3% من النيوبورنز عندهم major congenital anomalies because of chromosomal abnormalities, because of single gene disorders, polygenic or multifactorial disorders, and some teratogenic disorders that is due to the exposure of exogenous factors or exogenous drugs. Okay, هدول risk factors حكيناهم. We have some findings that are suggestive of having chromosomal abnormalities in the late second trimester زي ال early onset oligohydramnios خاصة إذا ما كان عندنا evidence of rupture of membrane. إذا عندنا برضه severe early onset polyhydramnios, severe early onset symmetrical intrauterine growth restriction, and if we have abnormal ultrasonic findings. Also, if we have uncontrolled diabetes in the preconceptional period, إذا في عندنا evidence of infection early pregnancy, and presence of soft tissue markers on ultrasound. Soft tissue markers هم abnormal anatomy in any place in the body or that can be detected by ultrasound. abnormal maternal serum screening. Invasive procedures for prenatal diagnosis, the chorionic villus sampling, amniocentesis, and chordocentesis. Chorionic villus samplings, it is used to confirm the diagnosis or suspicion of some genetic disorders. It is done between 10 and 14 weeks. We have trans-cervical approach and trans-abdominal approach. The advantages of CVS over other invasive prenatal diagnostic testing is the early detection. It is done between 10 weeks and 14 weeks. فإحنا إذا لقينا أي disorder that is incompatible with life, we can do termination of pregnancy at earlier gestation. Disadvantages إنه إحنا البروسيجر نفسها عندها risk of fetal loss. More than other maneuvers, especially more than amniocentesis. والdisadvantage الثاني إنه ممكن الكروموسومال component تاعت البلاسنتا تكون different from the chromosomal component of the fetal cells. هذا بنسميه placental mosaicism. It's about 2 to 3%. يعني ممكن يكون cells that we gathered from the placenta is different chromosomally from the true chromosomes اللي موجودين بالفيتال cells نفسه. طبعا contraindications for the transvaginal approach هو any infection, herpes, bacterial, cervicitis, بالإضافة للcervical stenosis. Bleeding with maternal coagulopathy is a contraindication for both approaches. Transvaginal versus transabdominal. Transvaginal is technically easier if the placenta is lower posterior. It can lead to more risk of infection, especially إذا عندنا أصلا evidence of lower genital tract infection. يعني ممكن نعمل إحنا ascending infection. More tissue can be gathered by the transvaginal approach, and it is less discomfort, يعني more comfortable. Transvaginal approach is more comfortable to the patient. This is the trans-cervical أو transvaginal approach. طلعوا كيف عندنا هون البلاسنتا posterior مثلا. Technically it's easier to be done transvaginally. هون عندنا الترانس-abdominal approach. شوفوا البلاسنتا anterior هون على الانتيريور wall. It's practically easier to do the trans-abdominal approach. طبعا دايما الكوريونيك villus sampling is done through ultrasonic guidance. دايما احنا عندنا ultrasound. بالvaginal approach بنستعمل vaginal ultrasound, وبالabdominal approach بنستعمل abdominal ultrasound. Complications, fetal loss 1 to 2%, oromandibular limb deformities, especially if we do an early chorionic villus sampling before 10 weeks. Vaginal bleeding, limb reduction deformity. طبعا بما انه في عندنا more risk of more complications early CVS اللي هي before 10 weeks, we should avoid it as much as we could. We should give anti-D to all negative group mothers. Amniocentesis typically done after 15 weeks, between 15 and 20. بعد إذا إحنا عملنا second trimester screening test ممكن according to its results نروح نعمل amniocentesis. Amniocentesis should be done after 15, but we have cases of earlier amniocentesis between 10 and 15 weeks. This entity has its own complications. أول إشي pregnancy loss rate increased, بصير comparable to the chorionic villus sampling about 1 to 2%, and it increases the risk of deformities like a club foot. يعني هو ببساطة إنه إحنا أصلا amount of amniotic fluid at this gestational age is low, فبنيجي بناخد منهم كمان amniotic fluid by amniocentesis، فبصير الامount of amniotic fluid decreased so much، فممكن تؤدي إلى ال deformities اللي بتصير في البيبي. The cells are grown in culture for chromosomal, biochemical, molecular, biologic analysis. We have several uses for the amniotic fluid. مش كلها اللي بنستعملها nowadays. في عنا يعني limitations for the خلينا نحكي ال detection of chromosomal abnormalities. بينما ال other uses هلا بطلنا نستعملهم زي الامنيوتيك فلويد، زي الالفا فيتوبروتين ليفل والبيليروبين والسيرفاكتنت والاسسمنت اوف فيتال لاج ماتشوريتي بالثيرد ترايمستر. هذول بطلنا نستعملهم حاليا. The only use أو the only important use of amniocentesis is the second trimester for the detection of chromosomal abnormalities. Okay, this is the procedure. We have risk طبعا of infection وعندنا risk of isoimmunization. Again, we should give anti-D for all rhesus negative mothers. Pregnancy loss في عنا about 0.5 to 1%. If early amniocentesis is done, the pregnancy loss is comparable to the chorionic villus sampling, about 1 to 2%. And we have risk of rupture of membrane and fetal trauma. Precautions أهم إشي to avoid the bloody tap. bloody tap اللي هو إحنا لما نيجي نعمل amniocentesis بندخل through the placenta. This will lead to bloody tap. bloody tap بقلل كفاءة detection في المختبر. يعني لما نبعت bloody tap على المختبر ما بيقدر يستفيد منها زي العينة العادية اللي ما فيها blood. Okay, so always we should avoid the placenta. نعمل good localization by ultrasound to the placenta and we try to avoid it. وطبعا anti-D as we said before. Cortocentesis, it has the same uses as اللي هم الكروموسومال abnormalities، بس بتتميز عنهم بإنه بنقدر نعرف إذا في عنا some types of infection عند البيبي intrauterine زي التوكسوبلازموسيس. ممكن احنا نعمل او نحسب ليفل الاي جي ام antibodies for toxoplasmosis in the fetal circulation. This is the procedure. بنسحب عينة blood immediately the cord. الادفانتجز انه faster within 48 to 72 hours بيطلع عنا الكاريوتايب، والريسك اوف ايرور فيها اقل بكثير من ال other two methods. Complications: bleeding from puncture site and fetal bradycardia. This is a summary for what we have said so far. الchorionic villus sampling والamniocentesis والcortocentesis. And thank you for your attention.